Hello, I am Dr. Ashley Booth, and I'm a board certified family medicine physician, and I'm also the owner of a private practice in Savannah, Georgia. I decided to do this topic because it comes up a lot, and it is health insurance versus health care. Are they the same or are they different? This topic comes up quite a bit, and people ask me about it, and we'll start to have a discussion. And when we start to have those discussions, they start to become sometimes they invoke a lot of emotion. People get very passionate about it. And I say, okay, we really need to just kind of sit down and have a discussion about what it is and what it isn't, and how to expect the things that we need to expect from it. So, my goal today is to simply do that. I am going to try to break this down as simply as possible so that way you will know what you're getting, what to expect, and how to get the most out of it. So, let's just get into it. We are in a healthcare system that is pretty much run by health insurance. And what I mean by that is that in order for us to get the health care that we need or to have access to it, we more than likely will need insurance to be able to do that. But when we start to get into that system, we start to notice that there are a lot of challenges, some barriers, things of that nature, and then it starts to become rather complex. And the question is, how do we get here, right? And what do we do about it? So, what exactly is health insurance? And health insurance is one of those things that I knew that I had a working definition of it, and I could pretty much tell people, oh, this is what health insurance is, or whatever. And I started to try to figure it out. And then I said, you know what? No, I am going to do some research so I will know exactly what health insurance is. So I started to do some research, and I want to be able to read to you what I found. One of the better definitions of health insurance was from Healthcare.gov. And Healthcare.gov says that health insurance is a contract that requires your health insurer to pay some or all of your healthcare costs in exchange for a premium. That's a lot. And so to break it down and to make it make a little bit more sense, basically it is saying that you paid money, you entered a contract with their health insurer. And what you did was you paid money to them. And that says, okay, now I want you, when I want to go and get medical care from someone, I want for you to pay them. And they said, okay, we'll do that. And that is the contract that you pretty much entered with them. But the problem that we get into it is when we're looking at insurance and we're trying to figure out what happens and with coverage and things of that nature, it is one of the things that it says is it will pay some or all. In most cases, it's not paying all, it's usually paying some. And we start noticing those issues with the sum. Because in the sum, how much is sum? Sum is a variation, and it varies with your plan. Some could be 1%, it could be 10%, it could be 20%, even 80%. But there is a sum, and we have to figure out what is that sum and what does that mean for us, right? So now that we know that it takes care of the sum, what I realize is that when people get into their health insurance, they realize what that sum really takes care of because they want to know, what am I going to be able to have access to? They want to make an appointment, they want to go here, they want to do that. And that's when it starts to show you and say, yes, this sum is taking care of this, or no, that sum didn't take care of that. And what do I mean? For instance, if you have a preferred doctor that you want to see, but that doctor is not in your network, do you have health care? I've seen this a few times with patients. They will either tell me that they want to see a certain specialist and they say, I want to see this doctor. And I say, okay, well, I'll send you there. And then what will happen is then that doctor's office will send us a message back later and say, denied, because we don't accept this person's insurance. Or that patient will find out from someone else and they say, you know what? I heard this doctor is great. They provide great service. They have a great bedside manner. That is where I want to be because I know that this doctor is going to take care of me. Well, then they call their insurance company and they say, I want to go see this doctor. Can I see them? And they say, nope, they are not on our list of providers, so you cannot go and see them. And if you decide to go see them, you're going to have to pay for that out of pocket. So if you have to do that, do you have health care? The other thing that I notice is when it comes to the pharmacy. Recently, a lot of my patients have had to switch their pharmacies, and it's not because of them, it was because of their insurance. And what has happened is they go to their one pharmacy, they enjoy the pharmacist because that pharmacist knows them, they know their health history, they know that this person is going to look over everything, make sure there are not any adverse interactions with anything. And then if they have questions, they can do it. The other thing, they may like that pharmacy because of convenience. It's close to their job or it's close to where they live, whatever. So they know what they're going to get and what to expect from there. They know that they're going to be notified when their prescriptions are ready, or they're going to receive updates if there's a delay. The communication, those are the things that they say, I really enjoy that. Well, when their insurance changed or their insurance decided to negotiate with other pharmacies in the area, there was another one that ended up saying, well, I'll see your patient. So the insurance said, well, now all of you guys have to go over here. And they said, but wait, I like this other place. And they say, I understand that, but if you want to go there, you're going to have to pay for that out of your pocket. And patients do not want to do that. So they go over to the other place and they find that either it's not as convenient because now they have to go across town versus it was right there next to their house or their, where they work. Or the other issue is that pharmacists, they don't have that relationship with them. And now they have to build that rapport again and have to learn the new pharmacy staff and all of these different challenges that can come ahead. So knowing that you're not able to decide where you want to go and get what you need, do you still have health care? That's one of the big questions. So now that we have looked at it and asked the questions of healthcare, what exactly is healthcare? Healthcare can look a lot of different ways for a lot of different people. It can mean that I want to be able to go X, Y, and Z and do this and do that. And someone else says, well, I wanted to pay for all of these different types of services. This is what I need. Healthcare looks very different for a lot of different people because we all have different needs. But there is a basic definition for healthcare. And again, I had to do some research because I said, what exactly is healthcare? Because I don't want to assume that it is something. I want to know exactly what it is. So again, I did look it up, and the dictionary says that it is an organized provision of medical care to individuals or a community. What does that mean? Basically, it's saying that you have an organized system, and you are providing a service to an individual or community. Okay. But what Wikipedia did, it went a step further and it said that it is the improvement of health via prevention, diagnosis, treatment, amelioration, or cure of disease, illness, injury, and other physical and mental ailments in people. And it's delivered by health professionals. So let's just look at that one. I like the Wikipedia one because it says that not only is it diagnosis and treatment, but it is also prevention. And you are able to get what you need to get cured, to get well, to take away that illness that you have. And it's done by healthcare professionals, not insurance. It is not dictated by insurance. It says the healthcare professional is the one that does that. Well, if that's the case, why do we have these issues that we have? So now that we know the difference between health insurance and health care, how are we able to use this to our benefit and maximize what we can get from this system? So there are some different benefits of insurance. And one of the biggest benefits that I can see is that what it does is it is able to handle some of those big ticket items. A lot of times you're able to use it and you're able to get a lot of benefit for the big ticket items because those things can cost thousands of dollars. Things such as going to the hospital. A hospitalization can really start to add up very quickly. 1 day, 2 day, don't even let us get into a week. That can really add up. An ER visit. I know of someone who told me that they were in the ER for 4 hours because they had a minor fender bender, wanted to go to the hospital, get checked out, saw the doctor, got a workup, did some imaging, and it was $20,000. Now, I'm not sure how much of their insurance that covered that, but to know, I said, "Are you sure? Like, you didn't stay overnight or anything like that?" And they said, "No, that was the bill that I received from that 1 4-hour visit." So knowing that an ER visit can be pretty pricey. There's imaging. If you need to do an MRI or a CT scan, those things can be pretty expensive. And not a lot of people have these this amount of money in their disposal, because what I understand is that medical bills are the number one cause of bankruptcy in America. Medical bills. Medical bills are the number one cause of bankruptcy in America. So you want to be able to get something, some type of benefit from your insurance so that it can help cover some of these costs for you. There's also some challenges that we notice with insurance. Because of that sum that we talked about, there is the cost. With the cost is unknown. So although your insurance is going to pay for certain things for you, the cost of it is still unknown. We don't know how much it's going to cost, but we know that you're going to pay for some of it. What portion of the sum? So you still need to make sure that you are finding something that is going to take care of you and do it well. So you may want one that's going to pay for at least 80% or 90% of your cost. Some people have some plans that pay for 100%, but you need to look at that and see, okay, what is this going to do for me, especially with the needs that I have right now? The other thing you need to think about is that there are limitations on where you can go and what you can do. We just talked about that with your doctors that you can go to. We talked about with the pharmacies, and it's all because what they call a preferred provider list. But I've talked to some people and they think that that preferred provider list means that these are the A-list top-notch doctors and these are highly ranking. Not taking anything away from those doctors or anything like that. They are doing a fantastic job. But the real reason that they are on that preferred provider list is because of the contract. They decided to sign a contract with that insurance company. So remember earlier we talked about, and I said that if you have insurance, that is a contract between you and the person who decided to insure you. It's the same thing with providers. They say, well, this is what we're offering, and this is our contract, and you have to sign and say, yes, I agree. And now you become one of their preferred providers. If you say, no, this doesn't make sense, this is a lot of things that you want me to do, but it doesn't quite fit what I think. Some people say, when I deal with this type of insurance, I notice that I get a lot of back and forth. I'm trying to treat the patient and do the things, and they keep saying, nope, you got to do it like this, or nope, whatever. And so they say, it's just not worth it for me. So that's what that means when you think about preferred provider list. It just means that that provider decided to sign a contract with that insurance company and say, yes, I agree to the terms, and this is how I'm going to treat your patient, and these are the things that I'm going to provide for them. And then they say, okay, great, and this is how they line it out and they do it that way. The other thing that you also have to remember is that with insurance and that limitation is that you can be denied at any point. For whatever reason, they can deny and say, nope, we are not going to pay for that. Nope, we are not going to do that. Nope, you cannot have that procedure or that treatment or that medication or whatever. And so that's something to be aware of and to understand. So there are some challenges. We know that there's some benefits, but also recognize that there are some challenges. And so what you have to do is just look at that insurance plan overall and see what makes the most sense for you where you are in your lifestyle. Want to let you know that you do have some options when it comes to an insurance focused care or insurance focused system, which is what we navigate ourselves through now, or if you want to move to more of a healthcare focused system. When you're looking at the insurance focused system, you are going to have to do some things yourself. You're going to have to be more proactive and make sure that you stay accountable and on top of things that's going on with your care and that you know. You have to make sure that you are prepared for your visits. So when you go to that visit, you need to know, okay, I want to talk to them about this because this is what's concerning me. And not only do I want to talk about it, I know that these are the types of symptoms that I'm experiencing, X, Y, and Z. So you want to make sure that you're prepared, and you want to also be an advocate for yourself. You're going to really have to speak up for yourself because you can really get lost in the cracks and fall through the cracks in this insurance based system. So you're going to have to follow up and do a lot of things for yourself. Be proactive, be an advocate, and be prepared. So make sure that you do that. So the other option that you have is the healthcare focus system. And this is basically where the care is focused on the patient because doctors are starting to say, you know what, I want to be able to focus on my patient and I want to remove as many barriers as I can because I want to be able to take care of the patient and what their needs are. I want to take away all the paperwork and all these other things that take away and distract me from truly focusing on my patient. And that type of care is a model that is, you may have heard of it. It's called either direct primary care or a membership based practice, a subscription based practice. And what I like to call it is a direct patient care practice. And that's what I started to do with my private practice because I wanted to really focus on the patient and give them the care that they deserve. And what we do is we take it back, focus on the patient by building relationships. We build relationships by spending more time with the patient. Visits are unrushed. They are 30 to 60 minutes to make sure that you are able to get what you need. You have the time to be able to discuss your concerns. It lets me learn about you so that I can now tailor different type of treatment plans to you. It also allows me to advocate for you because now that I know you, I know more about you and I know what I need to do for you. Then we are able to increase access. And we increase access because patients are now able to email us, text us, call us, do video chats if those are appropriate. But it allows us to be able to fully be able to be there for the patient and have it patient focused because what we understand is that life is busy. People have a lot of things going on. You may not be able to take off work, whatever it is. So that way you can be able to get the answers to your questions. And what we also found out is that a lot of patients are really starting to like this because they say, yeah, I called that other office and they told me it's going to take like 3 days before they get back to me. And don't call them back until they hear from, they say, I'll call you, don't call me again. Just leave the message and we'll get back to you in up to like 3 days. They said, well, my question is today and I need an answer like today or tomorrow. So now with this, you're able to be able to get your answers, your questions answered a lot quicker. And then it's affordable, transparent pricing. And what I mean by that is you know how much things are going to cost before you get it. With insurance, you know that they're going to cover a portion of it. Again, going back to that sum, but what is that sum still going to look like? If I have to pay 80%, but 80% of what? How much was the visit in the first place? With this, you already know. You know how much your medications are going to cost. You know how much it will cost if we have to do labs. You know what your membership is. You have all of these things that tell you this is what it is, and there are no surprises. So people are really starting to enjoy this type of practice. Not only are the patients enjoying it, the physicians are enjoying it, and it is starting to become a movement. And a lot of patients and physicians are moving to this because they want their patient. And what I tell people all the time, a happy doctor equals happy patients, and vice versa. When my patients are happy, I'm happy. When I'm happy, my patients are happy because we are all getting what we need. Now that you know the difference between health insurance and health care, be sure to choose what works best for you. Because again, I am not against health insurance. I know that there are some challenges, but there are some benefits. At the end of the day, it is about you getting health care, and only you know what that looks like. If you have any questions, be sure to send them my way because I know that this topic brings up a lot of different questions. And I'll be honest with you, I am not well versed on insurance. I don't know all the ins and outs, I don't know all the different plans. I just know the basics of what I see and what happens on my end as not only a physician, but also as a patient as well who has insurance. So there's some things that I know of and that I have seen, and I could probably help you navigate a little bit. But again, disclaimer, I do not know all the ins and outs of the insurance. But if you have those questions, I will do my best to answer them. Also, be sure to share this video with other people so they can now know the difference between health insurance and health care so they can get what they need. And then like and subscribe, turn on the notification bell so that way you will know when we put out new content so that you can stay well informed. Thank you so much for watching, and I will